have two different panels here. The first one shows me red blood cells, white blood cells, and platelets. And so looking at this one, I can see some mild changes with our white blood cells. It looks like it's indicative of a stress response. And so anything that causes us to not feel well, whether it's the car ride over here, GI issues, the new environment, us drawing blood, etc., all that can play a role in the stress response. I'm not too surprised about that. But red blood cells, platelets, those look nice to normal, so I'm happy with that. Looking at the next panel, this one shows me kidney values, liver values, protein levels, electrolytes, pancreas values, kind of the whole internal gamut. This one is where I have some concerns.
Okay.
And so our kidney values look great. I don't see anything scary there. Protein levels are appropriate. All of our liver values are significantly elevated. And so to give you kind of some numbers, ALT is the big one we look at. Usually the high and normal is about 120. Right now this is so high that my sample won't even give me a number. Okay. Another one, our AST should be no higher than about 60. We're at 302. GGT should be no higher than 14. We're a little over 80. And so all of these values are pretty elevated. And so it's telling me that we've got hepatitis or inflammation of the liver. Now what that came from, it's hard to say. Is it that she found something that she shouldn't have and we are having a toxicity? Is it something infectious? But usually with infections, I would expect to see a fever. I would expect to see elevations in our white blood cells. I'm not necessarily seeing that. Is it something autoimmune where her body's essentially attacking itself? Is there something like a cancerous process or an infiltrated disease that I just can't appreciate? Is there something with her gallbladder? It's hard to say definitively the exact origin of it. What I can tell you though is that her liver is taking a hit. Okay. And so typically I'd say prognosis is open to guarded because it depends on what caused it, right? If this is something like a cancerous process, then obviously that's more so towards the guarded side because there's not much that we can do. If this is kind of more so because of a toxicity, I don't know how much damage we can really reverse or how much function we can get out of it. If it's something like an autoimmune issue or an infectious agent, then potentially doing antibiotics, potentially doing steroid therapy may make us feel better. But again, I can't promise that we'll get those values back to normal. And so honestly, my best recommendation would be having an ultrasound done. What we can do here is we would essentially treat supportively. And so we would do IV fluids, we would do antibiotics, potentially do steroid therapy. We'll get started on a medication called N-acetylcysteine, and so that helps with any potential toxin exposure, liver support medications, etc., to try to cover all of our bases. The only thing that we wouldn't really be able to do would be the ultrasound until Wednesday.
So this is not good.
No, it's not good.
And to determine whether it is like cancer or there's no definitive way of determining if it's cancer itself?
I would say the ultrasound would give us the most information, but that's the test that we wouldn't really be able to do here because our radiologist only comes on Wednesdays.
Mm-hmm.
And so we can do it Wednesday and essentially treat with supportive care in the meantime, or to get that ultrasound done sooner rather than later. IndyVet would be the closest specialty hospital towards us, or to us.
Do you know if Bloomington and Bedford has ultrasound?
I'm sorry?
I was asking her if she knew whether our vets in Bloomington or Bedford could do the ultrasound.
Most of the time, primary veterinarians do like fast scans, but generally for a diagnostic ultrasound, it's not as common. They very well may. I can't say that. I can't say most of them don't.
Is it gonna make a difference to wait till Wednesday?
I would say if we are starting treatments and we're seeing a positive response, not necessarily, but if she seems like she's going downhill despite everything that we're doing, then it may be better to have that done sooner rather than later. We do have the x-rays, and so I am going to send those off to a radiologist just to make sure that they don't see an obvious mass, just because I thought it did look a little bit more rounded than usual.
Mm-hmm.
And so I'll still have that report that may give us a little bit more information. It won't tell me into the liver, so it won't tell me that kind of internal structure, but it'll tell me about size and shape. So it'll tell me if there's an obvious potential mass.
So you were proposing keeping her here and treating her until Wednesday?
Correct.
Okay.
Wow.
At least, yes.
How much 20 are we talking?
I'm not sure off the top of my head. I would have to have my technician put that estimate together, because our other option would be treating her supportively, and if she's eating, she's drinking, she's comfortable, we can try transitioning her to outpatient care and just have you come back for the ultrasound. But it would honestly depend on how she's doing clinically before I'd make that decision.
Well,
Armed with this information, do you think you could get her back into Wilmington or Bedford quicker than the 28th?
well, yeah, but can they do anything?
Yeah.
That's the whole thing.
And if anything, we can work on an estimate right now if you guys want to talk about it. And
Let's see. I mean, but yeah, work on that. Let us talk about it.
And if you do have any other questions or anything, just let me know or let Katie know, and one of us can hopefully answer for you.
Okay.
So is this left untreated would be fatal?
That would be my concern, is yes. Because I don't know the definitive cause, but I know that she needs some therapies for her.
And her liver is not functioning properly now. Is that right?
Correct.
And that's probably why she's not eating. Is that
And why
anything
she
to do
seemed
with
like
the
she was
cough?
uncomfortable when I was feeling her abdomen. I wouldn't expect that it would have anything to do with the cough. She also coughed a little bit back there when she was pulling, so I'm still leaning towards her trachea is the reason for the cough.
So you
But I
don't-
wouldn't expect that to be related to this.
Okay.
So we really don't know whether we got something treatable till we do the ultrasound.
That'll give us more information. They may recommend at that point doing something like an FNA or taking an aspirate or a sample as well to try to get more information if he can't appreciate anything obvious or appreciate a source, I guess.
Wow. Okay, yeah, get the estimate and let me. You do take care of credit?
Yes,
Okay. I don't have the card with me, but I've got my account number and stuff.
I think if they have your number, they should be able to look it up. But we'll definitely
Okay.
work on it. We'll let you guys talk about it.
Okay.
Like I said, any other questions, just let me know.
Mhm.
Okay.